Lisa from BSN1A. So today, I'm going to demonstrate on how to assess the mouth and oropharynx. In this procedure, we will be using 2x2 gauze pad, tongue wooden depressor, pen light, and gloves. So, good day ma'am. I'm Shimper Balisa. I'm going to be your nurse for today, and I was asked to perform assessment to your mouth and oropharynx. So, this is essential and necessary in order for us to find out if there are any abnormalities on your mouth and oropharynx. So, not only that, but also this exam will also give us baseline or initial information about the condition of your oral cavity. So, for your cooperation, I just want you to follow my instructions so that we can do it fast and easy way. So before that, I'm just going to wash my hands and I'm going to close the curtains for your privacy, especially the doors and the windows, okay? So before I start my assessment, ma'am, I'm going to ask you questions. What is your routine pattern of dental care? How many times do you brush your teeth, and is it after every meal?
Yes, 3 times a day.
Okay, 3 times a day. So do you use floss or mouthwash?
Mouthwash.
Okay, so when was your last visit to your dentist?
Has 5 months.
Okay, 5 months ago. So is there any presence of ulcer or other lesions at the moment? Like, do you have tonsils right now?
No.
Okay, so do you take medication that you are that is medicated to you? So it's good kasi sometimes medicine are not suitable for the patient and it may poison a person. So okay, do you wear dentures right now?
No.
Okay, thank you ma'am. So okay ma'am, are you already in your comfortable position po? So before that, I'm going to use my alcohol first for sanitation po. Then I will use my gloves po. I will wear it first. Okay, so in this procedure po, I'm going to use my pen light and tongue depressor. So first, I'm going to assess your lips and buccal mucosa po. I'm going to inspect the symmetry of texture, color, and contour. So when you say symmetry of contour po, it is the ability of the lips to first. When you say color po, sometimes the color of the lips varies to different person. Sometimes the color of the lips is pink, pinkish, yellow, or black. And it's important to know po kasi sometimes it may be indication of health problem. Like when it is blackish, sometimes it is the result of bad habits like too much smoke po, too much cigarette po. Sometimes naman when it is pale, it may the reason or cause of anemia po. When you see naman texture, the lips, the normal lips should be moist and smooth so that it is normal. Okay po? Also, the texture po sometimes may determine problems or dehydration. Also, I'm going to palpate your inner lips and buccal mucosa for its color, texture, moisture, and if there is a presence of lesions po, okay? I'm going to use my tongue depressor po and my pen light. So, ma'am, can you please press your lips as if you're going to whistle po? Okay? Okay, so can you open your mouth po? Okay, ma'am. So second po, I'm going to examine your teeth and gums. For that po, I'm also going to examine your inner lips. For the teeth, I'm going to examine the number of teeth present and if there are any problems po. For the gums, I'm going to examine for its color, bleeding, presence of edema, refraction, and presence of lesion po. Okay? So, okay ma'am. So, in other patient, we inspect their dentures po. Since you don't have any dentures po, it is okay. Pero in some cases po, we ask the patient to remove and inspect their dentures po for us to find out their conditions in particular po. Sometimes kasi the people who wear dentures, they encounter problems po such as discomfort, sugat, and other po, okay? So next po, I'm going to assess the tongue and the floor of the mouth po. So first, I'm going to inspect the position, the color, and the texture. When we see po the position, it is when your tongue is in the center po, and it is the big suck po. So I want you ma'am to protrude your lips po. Okay? Yan, okay. Okay, next po, I'm going to inspect the movement po of your tongue. Can you please roll your tongue upward po? Upward. Okay, from side to side po. Side again, okay. So next, I'm going to inspect the base of the tongue, the mouth floor, and the frenulum po. I want you to put the tip of your tongue po against the roof of your mouth, okay? Okay. So fourth, I'm going to palpate the tongue of the floor for any nodules, lumps, and excoriated areas. When we say nodules po, these are the piece of tissues. When we say naman po excoriated areas, these are broken, missing part, or this is how the lesions are in the skin of your mouth po, okay? So I'm going to use gauze pad po to touch or to hold your tip of the tongue po, and I'm going to use my index finger to touch po the back, borders, and the base. Can you please, ano po? When we say the back of the, ano po, tongue, this part po, and the borders po, sometimes kasi, it is important to examine the borders po kasi it will help us to, sometimes po kasi yung lingual carcinomas are in the borders po, okay, again. Okay. And third po, on the base, kasi it will help us to evaluate if there are masses or present po. Okay. So, examination of the floor of the mouth po is essential since oral cancer is very common nowadays po. And those individuals who are pre-exposed to oral cancer are those smokers po, tobacco users, and especially those alcoholic people po. So, next, I'm going to assess your salivary glands po. If there are dark openings, I will inspect for swelling and redness po, okay? Open your mouth po. Okay. So, here po. So now po, I'm going to assess your palates and uvula po. So first, I'm going to inspect the hard and soft palate for color, shape, texture, and if there are any presence of bony prominences. So I want you, ma'am, to open your mouth wide po and lean your head back po, and I will use my pen light and the depressor for proper visualization. Okay, ma'am. So next, I'm going to examine your uvula and for its position po and mobility while examining the palates po. So I want you, ma'am, to open your mouth po and say ah so that your soft palates po will rise, okay? Say ah. Okay, thank you, ma'am. So lastly, ma'am, I'm going to assess your oropharynx and your tonsils po. So for oropharynx, we'll inspect for color and texture po. I'm going to inspect one side at a time to avoid eliciting the gag reflex. So I'm going to use a tongue depressor po to press it against the tongue on the same side, about halfway back, while you, ma'am, I want you to tilt your head back po and open your mouth wide po. Okay? So next, I'm going to inspect for tonsils for color, discharge, and size po. And also, I'm going to elicit the gag reflex by pressing the posterior tongue with the tongue depressor po, okay? So, that's all, ma'am. That's our assessment for your mouth and oropharynx po. So, I'm just going to document my findings po, okay? And record it po. So, upon checking your assessment, ma'am, there's no presence of abnormalities on your mouth and oropharynx po. So, thank you, ma'am, and also for great cooperation po.